Interestingly enough, male rhinoplasty patients are the patients I hear are most likely to murder their plastic surgeon.
Wow.
So, yes.
How did you get that research? From Snapchat to television, plastic surgery seems to be everywhere. But let's see what Google has to say about it. For this episode, I brought on my new friend, Dr. Anthony Yoon, a plastic surgeon, to teach you and me everything we need to know about the surgery of plastics. Beep-whoop! Does plastic surgery hurt?
The answer is yes, it does hurt.
Okay.
I think a better question is how much does it hurt? And it really does depend on the operation. There are some surgeries that I do where literally people say they don't take any pain pills and they say it didn't hurt at all. And then there are other ones where they come in and they're mad at me. And I know they're gonna be mad at me because it was a big operation.
Does plastic surgery work?
I think some plastic surgery works, but actually some don't work. There are procedures that the FDA clears in cosmetic surgery as being safe, but not necessarily effective.
Does plastic surgery use plastic? I'm sure there's a procedure somewhere that uses a form of plastic. Tell me about it.
Technically, the term plastic comes from plastikos, which is a Greek term meaning to mold or to reshape, not actually plastic.
Does plastic surgery age well?
So the first question a lot of people ask if they're having a facelift is how long does it last? The studies actually show for a facelift, which is a surgery to lift the lower face and the neck, results can last anywhere from about 7.5 to 15 years. The other thing that's a huge topic are breast implants. And there is this idea that somehow breast implants hover after you put them in, and that if you have a breast implant that you'll never have to have a lift, that they're never gonna sag. When the reality is the exact opposite. They're like a piston in the breast, they're a weight in the breast, and so every time you jump up and down, if you have breast implants, it's gonna stretch that skin a little bit. So
that doesn't mean you shouldn't exercise, by the way. That's not what he's saying.
But you should, if you're thinking about breast implants, go with the smallest size in general that you know you're gonna be happy with, because the bigger you go, the heavier they are, and size does matter in these situations because weight does matter too.
Yeah, not only does it matter from an aesthetic appearance in terms of how long before the sagging occurs, but I oftentimes see my patients who do go too big and it actually starts affecting postural muscles, back aches, neck aches, and that's always something to think about because, you know, especially if you're sitting all day at work, standing, that can contribute to a lot of musculoskeletal concerns as well. Can plastic surgery melt? How is that the #1 search?
I mean, I guess you could do an experiment, take a breast implant and see if it melts, but like anything, I guess you're gonna get it up to a certain temperature and it's gonna melt.
Big surgery on my... Okay, we got all the usual suspects. Would you say these are in the order of most common? I would say maybe rhinoplasty would be the most popular procedure probably done in plastic surgery in the US. Would you agree?
So #1 is actually lipo because it's thrown in with so many other procedures. #2 would be breast augmentation. Rhinoplasty would be #1 amongst men. Rhinoplasty also has the highest risk of body dysmorphia, you know, where it's a psychiatric condition where people have a view of themselves that doesn't necessarily match with reality. Interestingly enough, male rhinoplasty patients are the patients I hear are most likely to murder their plastic surgeon.
Wow.
So, yes.
How did you get that research? I just typed in plastic surgery is, and the first result is plastic surgery is wrong. First of all, plastic surgery is not all cosmetic, right? First things first. Patients get dog bites, car accidents, horrific traumas, where plastic surgery can decide whether or not they suffer true mental health effects of their physical injury. So to say that it is all wrong is too much of a statement, and I think it goes too far. What do you say?
No, I agree. And really, I think everybody's got different morals on it. It's funny because when people ask me, oh, what do you do? I meet somebody new and I say I'm a plastic surgeon. I'm met with one of two responses. Either they recoil in horror at who I am, or they go, wow, that's really interesting. And the funny thing is when they recoil in horror and I say, oh, my wife, and if I'm with my wife, go, oh, my wife's a pediatrician, then they go, oh, okay, you're all right then. For me, the way I look at plastic surgery is it's an avenue to help people feel better about themselves and hopefully improve their quality of life.
Cosmetic surgery for dogs. For dogs? Do dogs get plastic surgery?
There are some animals that do get plastic surgery.
No way.
The true plastic surgery is reconstructive, and there are some animals that have actually had reconstructive surgery where plastic surgeons have actually gone and worked with veterinarians to reconstruct cats and dogs' faces. And there is some cosmetic surgery done for certain dogs when they have so much extra skin, like hound dog types of dogs, hanging over their eyes. It's actually been done. I've never done it before. I've got 3 rescue dogs that I love, and I would never want to put them under the knife.
So talk to me about your sort of everyday practice, because I think my viewers, I mean, a lot of them know you because when I had you on my thumbnail and I didn't realize that you were such a mega presence on YouTube that you actually are, people told me very quickly. So you have a big fan
saw
base.
that.
But for those of us who don't know or aren't familiar with the work that you do, tell us about it.
So I'm a board certified plastic surgeon. I've actually written 3 books, 3 best-selling books. I've been on, I can't tell you how many shows. I was kind of like you before you hit the scene. Now I'm like the old version of Dr. Mike, I guess, as a plastic surgeon. My practice actually, it's primarily all cosmetic surgery. I operate 3 days of the week. I see patients 2 days a week. I take emergency room call for people who get bit by dogs and car accidents. And I've been in practice now, 15 years. So 15 years ago, I was like the young guy, and now I swear to God, I feel like I'm the old guy.
Well, I'll tell you, you still look great. So you could have fooled me that 15 years in practice, that's really impressive. So you have this moniker that you go by, the holistic plastic surgeon. Take me through that, because I'm a big fan of holistic care. It's something that is important to me as a family medicine physician, as a DO. So walk me through that. What does that mean in the field of plastics?
Yeah, so I went through traditional medical training. I did, 4 years of medical school. I did 3 years of general surgery residency, 2 years of plastic surgery. I did a fellowship in cosmetic surgery in Beverly Hills, and I did really well starting out my practice. I was in a show called Dr. 90210 way back in the day, and my practice exploded. And one day, I thought I had hit the pinnacle. I had patients flying in from all around the country and even around the world coming to see me, and I had a patient with a terrible complication. And it really taught me that I didn't know as much as I thought I did. What am I doing? You know, I'm doing all these operations, but am I truly doing what's best for my patients? And so I really started on this path of trying to help inform and educate people on how to make their lives better using plastic surgery as an absolute last resort.
That's amazing, because you know, when I work with surgeons in my practice, the goal is always to work with surgeons who are not just eager to make the incision, to cut, as we say. We want someone who's going to weigh the risks versus benefits, explain them to the patient, get them on the same page so they feel comfortable. I do have a lot of patients that come to me and want quick fixes. Not surgical fixes, because I'm not a surgeon, but supplements, cure-all products. What's your take on that?
I do myself believe in supplements. I do take supplements. I think we can go supplement crazy. I think there are certain ones that we do know can potentially help and not hurt. A big one right now that's really controversial is collagen. And there are doctors who are very anti-collagen supplements. I'm on the other side.
It's a very controversial space. I think because a lot of the studies are done through, you know, the industry, unfortunately, because the NIH is doing very limited work when it comes to supplements. What university is gonna fund that? Because there's not a lot of money in supplements. So I definitely think there's room to improve on the research of the quality that we're doing with supplements. You know, my patients don't come to me very wealthy, especially I work in a community health center, and they're busy, they're working a lot, they don't have a lot of funds. So to them, they have to make that balance between choosing a supplement or joining the gym. So to me, I always point them in the direction of what's most proven, most efficacious, and that they're gonna get the most bang for their buck all across the board for their health.
Yeah, and that's the thing, is no question, it really does start with your lifestyle. It starts with what you eat, with getting the right sleep, de-stressing, you know, but after that, yes, are there things that I think we can do to help us, and from my standpoint, look better and feel better, no question. But yeah, I mean, you really do have to pick and choose what you recommend and what your patients are on. I think I have a different patient population than you, in that the patients who come to see me have disposable income because they're coming in to get Botox. They're coming in because they're interested in filler, maybe a facelift. Yeah. And so, you know, it is a bit, I think, potentially of a different crowd.
Is there any message you want to leave the audience with? I'd love to give you the final word on that.
I think if there's anything you remember about plastic surgery, is that you never regret work you didn't do. You only regret work that you did that you probably shouldn't have done. So if you're considering a cosmetic procedure, do your research, learn all about it, talk to a number of different doctors, and before you sign on the dotted line, before you go under the knife, make 100% sure that this is the right thing for you. And if you're not 100% sure, give yourself more time to think about it because you can always do it later.
Well said, Dr. Yoon. Thank you so much for joining us on the YouTube channel. Check out Dr. Yoon's own YouTube channel where he does all sorts of videos, everything you want to know about popular TV shows, reaction videos, and frankly, he's going to make you that much wiser about your potential skin and plastic surgery wants/needs. Hey Google, can I cure cancer with carrots? Well, click on this video to find out for another episode of Dr. vs. Google. And if you haven't signed up to the Patreon, do it now. $10 a month, all of it gets donated. Let's do it. Stay happy and healthy.